I'm excited to talk about how to test for Candida overgrowth in the digestive tract because it is so incredibly important. And it is often done wrong or not done at all. And I really want to share this with you because I've seen it have such a profound effect on so many of my patients. I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center. Over the past 25 years, I've tested literally thousands of patients for Candida overgrowth in the digestive system. And I've learned a little bit about what to do and what not to do. First off, it is incredibly difficult to test for a Candida overgrowth in the digestive tract. Even if you have had a stool test, most stool tests don't even look for Candida. And even when they do look for Candida, it often doesn't register on the test, even in patients who have a bad Candida overgrowth. And I'll describe why that is and how we can improve or actually prove that that is happening. And I'll also describe the 4 different ways to test for Candida in the digestive tract, the challenges with each of those tests and when those tests work and when they don't work. First, the stool test. Now let's talk about what your regular doctor will probably do. So when your regular doctor, your primary care doc or your general care physician or even your gastroenterologist, when they do a stool test, they specify to the lab exactly what they want that test to look for. And most doctors do not ask the lab to report on Candida. So you won't get a result for Candida. And this is usually why it doesn't show up. And this is often true even when you ask them to test for Candida, because it's just simply not in their wheelhouse. That's the first thing that you need to know. Even your gastroenterologist probably has little interest in a Candida overgrowth in the digestive tract because it's just not part of their specialty. It's not what they know. And even if they do test for it and it shows up, right, and they see it on the test, they'll probably tell you that Candida is always normal when it shows up in the digestive system, so they won't want to treat it. Now that's the first thing that you are up against. Second, and this is really critical, even when you do look for Candida in a stool test, about 50% of the time it won't show up. And I'm talking about that happening even when you use a super high quality DNA analysis of the stool, which is what we use here, and that's what I've used on thousands of patients. It still won't show up on a huge number of those patients. And we'll later prove why that happens, why that's going on. Now you're going, what? You're going, that sounds like a lot of BS, right? Well, it took me a lot of years to figure this out, and it was a really painful process with a lot of patients. But that is exactly what is happening. Candida can embed itself into the lining of the digestive tract and into biofilms and not shed. And so if it doesn't shed into the stool sample, then there's nothing to be found in the stool test, right? And the test results are going to be negative. So even a negative stool test does not prove that you don't have a Candida overgrowth in that microbiome. And I know this because I've treated hundreds and probably over 1,000 patients with antifungals that do nothing else but treat problems like Candida. And I did that even when they had a negative stool test, and those patients got better. Now, those antifungals don't treat anything else. Like we said, right? They're not treating bacteria. They're not treating anything else other than yeast, like Candida. So it had to be there. So keep that in mind. When Candida does show up in the stool, though, it's often way worse in the digestive tract than it is in the stool sample for the reason I just mentioned, because it doesn't usually shed really well and show up there. So when it does show up, it's usually incredibly important. And the amount of Candida in the stool is just a small representation of what is actually present in that digestive tract. All right, the second type of testing for Candida overgrowth in the digestive tract is antibody testing. So you can also look for Candida antibodies, and you can look for those in the blood. And Candida antibodies, such as IgG or IgA antibodies, which are formed against Candida, indicate that the immune system has formed a reaction, right, against Candida, which means that Candida is present or has recently been present in the body. And it's a nice supportive test, but in my experience, Candida antibodies are very often low or not at all present, even when Candida is showing up on the stool test. So it's not a very accurate test for Candida overgrowth in the digestive tract. And unfortunately, you can't rule out a Candida overgrowth in the digestive tract with a Candida antibody blood test. But if you do have elevated Candida antibodies, right, in the blood, it's usually a pretty good indication that Candida is present. Now, the third type of testing is urine testing. And what I mean by this is Candida produce a lot of interesting chemicals, some of which can be measured in the urine. And these include arabinose and other organic acids. And these chemicals are absorbed from the intestinal tract into the body. And then they're excreted in the urine. And only very specialized and unique urine tests actually look for these kinds of chemicals in the urine. And the urine tests run by your regular doctor or your gastroenterologist are not going to evaluate these types of chemicals, these types of organic acids. So it's probably not even worth asking them about it because they're not going to be familiar with it. You'll need an IBS specialist to help you sort this part out and run this kind of testing. But ironically, I've found that one of the best tests for evaluating a Candida overgrowth in the digestive system is exactly this, is a urine test. Now, what's the fourth way of figuring out, of testing for Candida overgrowth in the digestive tract? Well, the fourth way is literally treating it presumptively, which means you're treating it assuming it's there. And this is one of my favorite ways to find out if there's a Candida overgrowth. We treat you and we find out what happens, how you respond to the treatment. And this is how I figured out how important Candida overgrowths really are. I treated patients as if there was Candida even when I only had the symptoms to go on. And lo and behold, a lot of people got better. And this is a great tool in the right hands, but I need to point out that treating Candida is a lot easier said than done. And if you think you've already done that, there's an excellent chance that you probably really haven't done it. And I have a separate video on that topic. But here I'll just say that there are many non-toxic ways to treat Candida that often tell us a whole lot more than most tests will tell us. And tests are great, don't get me wrong, and I run them and I love them, but I'm more interested in the outcome of my patients and how they respond than I am in the test results. I use the test results to help me get places, but if they can't help me, we've got to trust what's going on in the patient, right? We've got to see how they respond. So keep in mind that even after you've treated Candida and you are feeling much better and the test results are looking much better, there's a high risk that it will come back. Candida is just one of these organisms that does that. It seems to be that way. So don't give up. As you now understand, it's a really challenging problem to assess and to find someone who can actually help you with. And if you think that you might have a Candida overgrowth, you might be right. We're here to help you figure that out if you need it. And if you found this video helpful, please give it a thumbs up and subscribe to my channel for more insight about Candida overgrowths in the digestive tract. Thank you very much for watching.